So brachial plexus. Okay. Yeah, this is when I'm going to switch. Actually, hold on. Intro. Okay, so when it comes to the brachial plexus, and like I said, these are my review slides. I'm gonna send them to y'all. You'll be fine. When it comes to the brachial plexus, yes, it does look complicated. Yes, it can be difficult, but also, yes, you all can do this. Everyone before you has had to memorize this. You will learn it. So let's break down the brachial plexus step by step to help you learn it. And you're going to need to memorize it. And you're going to need to memorize it such that if they give you a picture or like a drawing of the brachial plexus, and they give you a scenario where a person has injured something, so they have weakness of something, you need to be able to identify the nerve that is damaged just from a plain brachial plexus picture. So you pretty much need to know how to identify every nerve on a brachial plexus that's drawn out. So yeah, so let's go through this. So first thing is everybody has their own mnemonics that they like to use when memorizing stuff. For memorizing the 5 parts of the brachial plexus, I liked to use Read the Darn Cadaver Book. So that breaks down into your roots, which the spinal roots of your brachial plexus are C5 to T1. And then trunks, where you have a superior, a middle, and an inferior trunk. The divisions, which are anterior and posterior, which are all in reference to the subclavian artery. So are they anterior to the subclavian artery or posterior to the subclavian artery? And we'll see the divisions in a little bit. The chords, which are lateral, posterior, and medial, and these are in reference to your axillary artery. And then finally, your terminal branches, and there are 5 of them. So your 5 terminal branches are your musculocutaneous nerve, your axillary nerve, your median nerve, your radial nerve, and your ulnar nerve. So if you look in Netter's, this is the brachial plexus that they have in Netter's. And normally, if it weren't COVID and if this weren't virtual, I would have us draw this out. So I do recommend that you draw out the brachial plexus and then create it as a quiz for yourself. When I did it, let's see, I know it's in here somewhere. There we go. So for me, when I was learning this, I drew this out with labels like this shown here on the front of a piece of paper. And then on the back, I had all of the labels with the answers so that I was able to just quiz myself by flipping that page back and forth to see, had I memorized this correctly? Since we can't draw it out, what we're gonna do is I'm gonna literally just like talk you through this. And I think you right now should pull out a piece of paper as we do this. If you don't want to do this, there is a really good video here that I provided the link for y'all, so you can click on this later, where there's this dude, his name is Dr. Preddy. It's on YouTube. He looks like a football player in scrubs. Having said that though, he breaks it down, makes it super simple for you when drawing it out. I have another Dr. Preddy video link later when it comes to learning innervations of like the arm and the forearm, but that's on another date. But yes, I like Dr. Preddy for like his upper limb stuff. So we're gonna go through it, but if you wanna listen to, or if you wanna watch him draw it out, you'll be able to go to this link later. Okay, so brachial plexus. So first you can see here are roots. So here's C5, C6, C7, C8, and T1. The first thing that I want you to notice when it comes to these roots is see how C5 and C6 join together, and C8 and T1 join together, but C7 does not. That's going to be the first thing when you're drawing your brachial plexus, when you're orienting yourself. C5 and C6 are going to come together here. C7 is just straight. C8 and T1 come together here. Now, you have a nerve coming off here, and a nerve coming off here, and a nerve, oh, hold on, did I label that one? Not that one. Okay, so just these two. There are two nerves that you need to know specifically in relation that for the brachial plexus that come off of the roots. So this first one here, labeled number 1, that's your dorsal scapula. So your dorsal scapular nerve right here. So when you're drawing your brachial plexus to study, you're going to want to have like one little nerve coming off right here for dorsal scapular. Next one is this guy right here. So you can see how it's taking fibers from C5, from C6, and from C7. So C5, C6, C7, labeled here number 2, that is your long thoracic nerve. So when you draw it, make sure you have your roots coming from C5, C6, C7, long thoracic nerve. Oh, and I need to mention this now too. You're going to want to know the roots for these nerves because they can quiz you on that too. They can, unfortunately, give you a question where the patient has a weakness of some action. You know that it is related to the specific nerve that's damaged, but then they just give you a list of nerve roots and you have to pick which one is correct. So your dorsal scapula is just C5, but your long thoracic pulls from C5, C6, and C7. So those are the two nerves off of the roots that you got to learn. Okay, so moving down, we're now at the trunks. So you can see how now here's your superior trunk, your middle trunk, and your inferior trunk. So the next two nerves that you have to learn, they both come off of the superior trunk, which makes it a little bit easier. And because they both come off of the superior trunk, I believe they both have C5 and C6 as their roots. But then you'll see here, so this number 3, that's your nerve to subclavius. Remember subclavius, that muscle that's underneath our clavicle. Versus number 4 here, that's your suprascapular. And we'll see later on, the suprascapular nerve has a specific path that it takes that you have to memorize because that's another question that they can ask you is the path that the nerve takes in relation to the suprascapular artery. So just a note, when it comes to anatomy, if things travel together, but they're like different, they'll often get the same name. So if you have a nerve, an artery, and a vein that are all traveling together in the same direction, they will often get the same name just with a modifier. So there is a suprascapular artery and a suprascapular nerve. That's completely normal. It happens quite often. So just be careful when you say suprascapular. Are you talking about the nerve? Are you talking about the artery? It can get tricky, so just be aware. Just like you're going to have, there's a radial nerve and a radial artery, but also there's the radial bone. So yeah, anatomists try to like group things together when they're labeling and naming, which, you know, fundamentally does make sense, but can be confusing. So just be careful. So just to reiterate, here are the two nerves that you need to know from your 3 trunks. The superior trunk is the only one that has nerves coming off of it. And the 2 nerves that you need to know are nerve to subclavius and suprascapular nerve. When it comes to the divisions, no nerves, like no branches come off of the divisions, which is nice. So you don't have to memorize anything from there. You just have to, when you're drawing it, you know that there's this X here, and then there's this like one part here. A thing to help you understand better how you're going to associate these nerve roots with these nerves that come further off, that branch off, is that nerve roots, when they're coming, they can only go forwards. They can't go backwards. So see how C5 and C6 are both part of the superior trunk? Well, that means that everything forward of the superior trunk can have C5, C6 roots. And like C7, since it's coming like straight through, here's your middle trunk, it can go forward as well. But notice how like C5 cannot come back down this way and then go forward. Like that's not something that can happen. It can come down this way and go forward, but say it can't like come down and then go backwards. The nerve roots are always just going to go forward. So that's something that like Preddy will talk about in his video when he goes over it. But yeah, so the nerve fibers are just going to go forward when you're trying to figure out what nerve fibers are a part of these terminal branches. Okay, but yes, your divisions, nothing comes off of here. Just learn you're making an X and then a Y when you're drawing it. Okay, so now we're at the chords. The chords have a lot of little branches that you need to learn, but you can chunk them together when you learn them and it makes it easier. And once again, this is how I did it. So it helped me a lot. So first things first, notice how you have this branch coming off of here, your lateral cord, and then this branch coming off of here, your medial cord, and then you have this piece that connects them. Well, knowing that this branch is coming off of your lateral cord is helpful because this nerve is lateral pec nerve or lateral pectoral. This one coming off of your medial cord, number 6, is medial pectoral. And I didn't label it here, but I'm going to say it. Hopefully you guys remember this for later. This branch that connects the two of them, this branch is called the Ansa Pectoralis, A-N-S-A, Ansa Pectoralis. I know that Dr. Austin previously has talked and lectured about this in classes past, so I'm just going to mention it again, that this is the Ansa Pectoralis, A-N-S-A, that connects your lateral pec and your medial pec. So I group these two together in my brain, obviously, because they're pectoral nerves. So our next set, 7 and 8, I also group together. So they're both cutaneous nerves, but they go to different areas. So 7 is your medial brachial cutaneous versus 8 is your medial antebrachial cutaneous. So when you see antebrachial, think forearm versus brachial, just think arm. So antebrachial cutaneous is going to have cutaneous innervation more distal versus brachial cutaneous is going to have cutaneous innervation more proximal. So medial pec, medial brachial cutaneous, medial antebrachial cutaneous. And then now we have these 3 nerves grouped together here on our posterior cord. So these I chunk together because depending on which name you use, all of them have subscapular in the name. And this is also associated directionally as well. So number 9 is your upper subscapular. Number 11 is your lower subscapular. Number 10 in the middle is sometimes called middle subscapular, but most often though, it is called thoracodorsal. Oh, and I'll add an S in there because that's a typo. But yes, this is thoracodorsal, also known as middle subscapular. And then you have upper subscapular, which is more proximal, versus lower subscapular, which is more distal. So lots of nerves coming off of your cords here. You're going to need to be able to identify them just off of like a plain picture of your brachial plexus. Okay. And so now finally, Our terminal branches. First one at the top is musculocutaneous. And this is coming off of your lateral cord. Next two, I'm going to talk about together. You can see they're both coming off of your posterior cord. So radial is this thick one here, number 14, versus axillary is this thinner one here, number 13. Depending on the drawing that you see, axillary can come off above or it could come off below from radial, but you just need to know radial is going to be like the thicker one coming off of the posterior cord versus axillary is going to be the thinner one, because axillary comes off and then it innervates your deltoid and I believe your teres, is it teres minor or teres major? I'll look it up. But it innervates your deltoid and a teres muscle and then does cutaneous innervation over the deltoid. Versus radial is going to do innervation on the posterior aspect of your arm and your forearm, going all the way down to your hand. So it has way more nerves that, way more innervations, therefore it's going to be a thicker nerve. It's like doing more. Up, and I think there's somebody in the chat. Okay. What's up? Minor, thank you. So teres minor and deltoid. So radial, axillary. Our next terminal branch, so notice here, and this is how a lot of people will remember it, so it's helpful. Notice here how you create an M. Well, that's how people will remember the name of this nerve here, the meeting of your medial and lateral cords. It's your median nerve. Now, yes, I know this is annoying, but unfortunately, you have to memorize this. It's median with an N, median nerve, as opposed to the medial cord, as opposed to the middle trunk. Yes, it's annoying. Sorry, guys, it's the way that they named it. So median nerve, creating like it's the tip of your M in the middle is the median nerve. This is another, and I'll give you another heads up when it comes to like the drawings that they've done of brachial plexus that I've seen on quizzes and tests. So because this is like a joining at like the tip of the M, technically they can have the picture where this posterior cord drifts a little bit down and your radial and axillary nerve are on this side. That can be another way that they try and trip you up. So you just have to be able to trace the brachial plexus and see, okay, this is coming off of the lateral cord at the top, so musculocutaneous. Here's my posterior cord. So these have to be radial and axillary, and then the meeting of the lateral and the medial is your median. So this area can be down here, axillary can be coming off the other side. You just got to remember, you just got to know the picture and can translate it for yourself when you're looking at this during your test. And then finally, our last terminal branch here, number 16, this is ulnar nerve. So notice how ulnar nerve, there's no way for it to have nerve fibers coming from C5 and C6. Or C7 for that matter, I believe. Yes, it can only get C8 and T1. And you can see that pretty plainly from this picture when you're tracing it. So going straight, you only have C8 and T1. Ulnar nerve was always the easiest for me to remember the nerve roots that it came off of, because C8 and T1 came here, and going forward, you can only get fibers that way. Versus like median and radial, I think had fibers from all 5 roots, or at least 4 of the 5 roots. So yeah. And then musculocutaneous was like C5, C6, and C7, I believe. But yeah, this is your brachial plexus. And like I said, when I was learning it, I would literally do this and just like quiz myself. All right, what's 5? What's 6? What's 2? And you just got to practice. You can do the flashcard form. Sometimes I would redraw it out from memory, like the brachial plexus from memory, along with like the little pieces coming off, and then label it and see if I was right. So this is something you just got to practice, folks. It sucks, but it's something that we've all had to do, and you can do it. Okay.